Hello friends, today we will discuss about the dental management of diabetes mellitus. Overview. Diabetes mellitus characterized by the high blood glucose level and inability to produce or use insulin. More than 240 million person in the world have diabetes mellitus. It's one of the leading cause of death in United States. Dentists should recognize diabetic patient by history, clinical sign and symptoms and laboratory test and refer it to the physician when needed. Insulin. Glucose level in the blood is increased after food intake. Insulin is released from the beta cell in the pancreas and released into the blood. These hormones bind to the specific receptor in the body cells and help absorption of glucose into these cells, which then glucose level in the blood normalize. However, diabetic patients have problem in secreting insulin, or there is a cellular resistance to insulin, or both. These lead to the high blood glucose level that lead to many symptoms and complications. Classification. Diabetic patient can be classified into three types: type 1, type 2 and gestational diabetes. Type 1 less common, 10% usually younger than 30-year-old. Beta cells in pancreas are destroyed and there is no insulin secretions. In type 2, most common, 90% usually obese in older patients, there is a partial insulin deficiency and cellular insulin resistance. Gestationals, which occur in 5 to 7% of all pregnancy and result in a loss of fetus. In case of the surviving fetus, they usually overweight. When pregnancy over, mother glycemic control return to the normal, but these women are at risk of developing diabetes in the next 5 to 10 years. Classifications continue. Other specific types include more than 56 diseases that cause destruction of the beta cells, such as genetic inflammation, cancer, surgery, endocrine conditions such as hyperpituitarism, hyperthyroidism, or could be drug induced diabetes. Clinical sign and symptoms. Patient with a type 1 diabetes. The onset of the symptoms is sudden and acute. Patient usually non-obese, child or young, adult younger than the 40 years old, but could occur at any age. Signs and symptoms include polydipsia, polyuria, polyphagia, weight loss, loss of strength, marked irritability, recurrence of the bedwetting, drowsiness, malaise, blurred vision. Patients also may develop ketoacidosis, which characterized by the symptoms of vomiting, abdominal pain, nausea, tachypnea, paralysis, and the loss of the consciousness. Clinical signs and symptoms continue. Patient with the type 2 diabetes usually affect obese individual older than the 40-year-olds. Symptoms usually develop gradually and less common. Symptoms include polydipsia, polyuria, polyphagia, weight loss, loss of strength. Other symptoms related to complication of the diabetes type 1 and type 2 include skin lesion, cataract, blindness, hypertension, chest pain, anemia. Clinical sign of symptoms features type 1 and type 2. Frequency in type 1 is 5 to 10%, type 2 frequency is 90 to 95%, age of onset is 15 year in type 1 and type 2 14 year and over. Body build normal or thin in type 1 and type 2. There is obese patient. Severity type 1 is severe and type 2 is a mild. Insulin requirement, almost all patients are required in the type 1 and in type 2 25 to 30% of patients need insulin. Ketoacidosis in type 1 is a common thing and type 2 there is uncommon ketoacidosis. Rate of clinical onset, type 1 is rapid and type 2 is slow. Diabetes complication. Generally, patient with a poorly controlled or uncontrolled diabetes mellitus is a risk of infection, poor wound healing. Complication of diabetes include metabolic disturbance, ketoacidosis, cardiac atherosclerosis, hypertension, congestive heart failure, and myocardial infarction. Eye retinopathy, cataract, blindness, kidney nephropathy, and renal failure. Limbs ulceration and gangrene of the feet, which lead to the foot amputations. Neuropathy, dysphagia, distension, diarrhea, muscle weakness, and cramps, numbness, burning pain. Diabetes mellitus is the seventh leading cause of the death in United States, mostly due to the cardiovascular complication associated with it. Diabetes Diabetes diagnosis in dental office. Most common type of the diabetes is type 2. Dentists should be able to recognize diabetic symptoms and interrupt screening test. However, referral to the physician for definitive diagnosis and treatment is important. Patient is diagnosed with diabetes when one of these tests is confirmed. Fasting blood glucose level above the 126 milligram per deciliter, random blood glucose per symptoms 200 mg per milligram per deciliter, oral glucose tolerance test greater than 200 milligram per deciliter, HbA1c is greater than 6.5% of the RBCs. Treatment plan for the minor or oral procedures. Patient with uncontrolled or poorly controlled diabetes should be sent to physician for treatment. Patient with a controlled type 1 diabetes, in case of non-invasive dental procedures, patient can be treated just like non-diabetic patient. However, be aware of patient susceptibility to infection and poor wound healing. In invasive dental procedure, after consultation with the patient physicians, blood glucose level is taken. If it is between 70 to 200 milligram per deciliter, then dental procedure can be done. If it is greater than 200 milligram per deciliter, then elective dental procedure should be deferred until glucose level normalizes. Treatment plan for the minor oral procedure. Patient with a controlled diabetes type 2, no treatment modification required. Be cautious of the patient's susceptibility to infection and wound healing. Wound healing for type 1 and type 2, major surgical procedures with general anesthesia require special management other than what described above. These guidelines are for diabetic patients who suffer only from diabetes mellitus without any complications. Medically compromised diabetic patients who suffer from diabetic complications such as hypertension, renal impairment require special attention and treatment plan modification. Insulin shock. When a patient takes their insulin and do not eat, this result in a hypoglycemia that called insulin shock. It occurs when they eat but take insulin overdose or oral hypoglycemic medication overdose. The initial signs and symptoms include hunger, weakness, trembling, tachycardia, failure, and sweating. If left undetected, it can lead to severe symptoms, hypotension, hypothermia, tonic-clonic movement, and loss of consciousness. Dentists should instruct the patient to take their usual meal and insulin injection before coming to the clinic. Morning appointment is preferred. Dentist instruction prior to the dental visit. Patient should eat normal meal before appointment and take their medication. Take a normal appointment, have their medication and glucose, juice, non-diet cola, etc. available at the dental visits. Inform the dentist about any insulin reaction when they first occur. After dental appointment, patient should keep his eating routine and medications. They should keep good oral hygiene and restrict to the patient dentist instruction to prevent infection and impaired wound healing, dry socket and osteomyelitis from happening. In case of acute infection, antibiotic prophylaxis for patient after dental procedure is not required unless patient suffer from infection and or systematic symptoms of infections like lymphadenopathies and fever occur. In case of patient with infection, patient insulin dose should be altered with consultations and infection is treated locally. Oral manifestation of the diabetes. Patient with uncontrolled diabetes mellitus may suffer from xerostomia, drying mouth, poor or wound healing, infection, oral ulceration and lesion, candidiasis, burning pain in the mouth, periapical abscess, and caries. Because there is no saliva flow, so caries chances are very high. These are due to excessive loss of tissue fluid, altered response to infection, microvascular changes, and increased glucose level in saliva. Oral manifestation of the diabetes. Patient with diabetes has increased inflammatory response, reduced wound healing, and microvasculature changes which contribute to periodontal diseases, gingival diseases, and proliferations, periodontal abscess. Dental management. Follow what have been discussed earlier regarding management and treatment planning for such patient. Analgesia. Avoid aspirin and NSAID in patient taking sulfonylurea because it can worsen the hypoglycemia. Antibiotic prophylaxis is not required unless there is an infection or brittle diabetes. Anesthesia. Use usual doses. However, in patient with cardiac symptoms, limit dose to 2 cardiac containing 1:1 leg part epinephrine. Blood pressure. Monitor blood pressure because diabetes is associated with hypertension. Thank you very much.